Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Welcome back, listeners. I'm Lauren Smith, the Manager of Business Development here at Women's Hospital and the host of the Unprivate Parts podcast. When someone you care about is diagnosed with cancer, it can be hard to know what to say or what to do. Most people want to help, but the fear of saying the wrong thing or overstepping can make even the most well-intentioned supporters feel awkward or unsure of how to show up. In today's episode, we're accompanied by Ms. Hannah Whitehurst, an oncology social worker here at Women's Hospital, to discuss how friends, family members, and coworkers can support a woman going through breast or gynecologic cancer treatment. From offering practical help to understanding boundaries, we'll explore what truly makes a difference and what might be better left unsaid. Thank you for joining us today, Hannah. Can you start by telling us a little bit about your role as an oncology social worker?
My role as the oncology social worker is really just support to the patient. We have a great team here of a multidisciplinary team of nurse navigators, dietitians, and then us social workers. And so we all kind of bring different things to the table. And so for social work, we're here for the support, the tangible resources, the things that, sometimes you don't want to talk about. We kind of try to help guide those conversations. A lot about mental health, emotional health, making sure the patient feels like their whole self is being, accommodated for. I think when you hear cancer, you think of all the medical things, right? You think about, okay, what is chemotherapy going to look like? What is surgery recovery going to look like? But then secondary, you think about, well, what about my family? What does this mean for my job? So we're kind of there to be the ones to fill in those gaps, make sure that the patient feels like every part of them is being cared for.
And at what point does the patient see you?
Yeah, that's a great question. So it kind of depends, actually. So we have our Merck grant. So I work on part of that, and we address the high-risk patients who live in specific zip codes. And so for those patients, we meet them the day they get their diagnosis. So the day our breast surgeon or gyn-onc says you have cancer, we go and meet them there. If they are not part of that Merck grant, then we meet them when they meet their medical oncologist. So for a lot of our patients who are doing chemotherapy, they do what we call chemo school, chemo teaching. And so we meet them after that and kind of go over all the things related to what the next steps of their care is. If they're just a surgery-only patient, we meet them kind of at their pre-op to make sure any tangible resources are given at that point. If they're radiation, we meet them at the start of their radiation, or if their survivorship navigator identifies a need. So it really depends on the patient. The biggest thing we all say is we meet them where they are. So whenever they need us, we're there and ready to support them.
And when you say you're there for the day of diagnosis, that's after their appointment, or do you go to their home? Is this on site?
It's on site. So if it's in the breast surgeon's office, the breast surgeon does her part, the nurse navigator does her part, and then I come in as the last person.
When someone you care about is diagnosed with cancer, it's natural to want to help, but many people aren't sure where to start. I know for me, I don't know what to say. From your perspective, what does it really mean to show up for someone going through treatment?
I think the biggest thing is kind of like how I said we meet patients where they are. As the support person, meeting the patient or the friend or the loved one where they are. So if there's someone who is very private, showing up for them might just be, hey, I'm here if you need something, like I will come get you a meal, or I'm going to make this meal train, we're going to do that. If that's more so they're private, they don't really want, a lot of people being involved in it. If it's a person that you're really close with and they need that support and they want that person person kind of there for them, then it's like, hey, when's your next appointment? Can I drive you to that appointment? You know, do you have kids? Can I help get them off the bus for you? Do they have activities? Can I bring them to those activities? Kind of thinking of ideas that really match that patient. So it is kind of dependent on the person. A lot of patients say that people say, oh, I'm here for you. I'm so ready to help. And then when they need something, the person's not there. And that really hurts them because they're like, I was vulnerable and I needed help. And then you didn't show up. And so if you do make the offer to show up and be there, make sure you really want to do it and are willing to show up, because when the patient does need you, it is very much meaningful for them to have you there. It can make or break that treatment day for them. You know, we've had patients who said their loved one was going to come with and the loved one didn't come. And so that patient's sitting there by herself all day. And that's a hard thing for that patient. And so, you know, making sure if you say you want to be there, that you are going to really be there.
What are some of the most common things friends or family say with good intentions that might not be as helpful as they think?
A lot of friends or family are very positive. And so they're like, you got this. Everything happens for a reason. You know, God wouldn't bring you to this unless he wants to bring you through it. Like a lot of things that I think are good intentioned and they're so positive. But sometimes in the moment, the patient just wants to say, this sucks. Yeah. Because it does. Like, we will be the ones who are honest. Like, this sucks, having to go through cancer. No one wants to go through cancer. And so I think support's always wanting to be positive, be that cheerleader. And they don't realize, well, sometimes that's taking away from the true struggle this patient is going through. You know, you're minimizing their feelings like, hey, this is nothing. You got it. Well, you know, this is a lot. Like, I do not feel like I have this sometimes. And so I think kind of reframing the thought process instead of saying, like, you got this, saying, like, hey, I know you can do this, but if you need help today, we're here for you. Or, hey, I know this is hard. How can I help today? You know, kind of reframing that overall positivity into making sure they feel validated in how they're feeling first.
Because you probably don't want to say, like, I'm sorry, and, you know, go the other way. But you do want to acknowledge, yeah, this is not fun.
Correct, yeah. I think just always being willing to acknowledge that the situation isn't always positive. Just being able to sometimes say it how it is, because that helps them feel like, oh, I'm not crazy, that this kind of is unfortunate, you know. It just helps them feel like people understand.
That's good. And sometimes people ask, let me know if you need anything. Why can that be difficult for patients to respond to? And what might be a better way to offer help? I know you said the follow through, but are there specific things that, like, I've never been through this journey, that we can offer rather than just a blanket statement?
For sure. I think when we say, like, let me know how I can help. A lot of our ladies, I always call them that they're superwoman. You know, they come in and they're so used to being the person who's taking care of everything. Mm-hmm. They don't ask for help because, girl, they're going to get it done. Yeah. And I love it. It's a great attitude. But I have to really remind our patients, you know, when you're going through something like this, being superwoman kind of changes. Being a superwoman here is asking for help. Like, that's a sign of strength. When you ask for help, that's showing to your support people that you are strong and willing to ask for help. Because sometimes when we struggle and we don't ask for help, that's a weakness. And so really trying to reframe it for the patient of, no, asking for help is a powerful thing. You're showing that females can ask females or males for help. Like, you're showing that it's okay to ask for help. And that's so empowering to our other females. And so I think that is the first thing. You know, it's hard to ask for help, but trying to really reframe that. And then when you say, you know, what are some specifics? It's hard because, again, it's so dependent on the person. But a lot of the times it's can I bring you a meal? Because a lot of patients, you know, they don't feel like going home and cooking. If they're working throughout treatment and they're tired and the last thing they want to do is come home and have to cook a meal. Right. So sometimes it's just offering to cook a meal. Again, it's hard because sometimes patients have different side effects, so you have to be accommodating to where they're at, but something like that. Or saying, hey, can I come do some laundry for you? Because you don't realize how tiring it is to put the laundry in the washing machine, take it out, and then have to go and fold it all by yourself. That can be a lot more taxing than you would think. So, can I do some laundry for you? Can I come clean your house so when you come home, you don't have to worry about cleaning a house? A lot of our ladies also right now are a little bit younger, and so they have kids. And so how do I go to all my kids' events, and how do I get them there, and how do I make sure they're cared for? So asking those ladies, can I pick your kid up from the bus for you? Can I bring them to soccer practice tonight? Doing those things so that they don't feel like they're going from treatment to work to child care. It's so much.
So much.
So just trying to take off some of those kind of things, the more tangible things like you're saying, that can help a lot.
And then what about the patients that don't want to ask for help? Maybe they don't want the attention. And they're not that person, but you're going to make sure they get help one way or the other. Do you think that's imposing, or do you think it's well received once, they say, oh, I don't want the attention, but you just show up with a meal? Or
Yeah, so I think it is usually well received if they say, hey, I don't want the attention. Well, maybe don't send out the meal train, for example, but just say for yourself, I'm going to bring a meal Wednesday. I'm not even going to see you. You drop that meal off, you text that person and say, hey, check your porch. And then, you're not even there, so they're not really even having to face you and say thank you. So that's a way for sure. Some of our ladies, too, you do it once, and then you'll start to notice that wall come down a little bit. They'll kind of start telling you a little bit more. And then it's like, oh, okay, that's your opportunity. Keep showing up, keep doing those things. But you do have to respect. If they say no, then you have to respect that in the best possible way. So maybe finding a different way. Hey, how's your mom doing? I know she's the one bringing you to appointments. Maybe talking to her mom and being that support to that patient's mom. Because I think we forget that, yes, the patient is the one going through it, but their loved ones are going through it just as much. Our spouses who show up, they're sitting there and they're like, I can't take this away from my spouse. It's a very helpless position to be in. And so sometimes that support could be giving it to the spouse and saying, hey, how are you doing? Are you doing okay? Because then the patient knows that their spouse is being taken care of. Because that's a lot of our ladies' concern. They say to us, they're like, I'm worried about my husband or my wife. What do I do? I can't for myself take care of me. They're taking care of everything. So when you help the spouse, then the spouse is being taken care of, and that's therefore taking care of the patient, if that makes sense.
For coworkers or managers, supporting a colleague with cancer can feel very delicate. What are some respectful ways to check in at work while still honoring privacy and boundaries?
That's another tough one, I would say, that because there is so much that sometimes when they're at work, they don't want to think about this. Right. They're there and they want to have that escape for the few hours that they can work that day. So as a coworker, I would say, asking them, how is your workload treating you? Can I help with that? So it's not really you're helping necessarily with their treatment. You're not asking how they're doing with treatment. You're asking specifically with work. Can I help you? Some patients maybe might not be as organized because they do have brain fog. There is the true side effect of brain fog. And so it's so hard for them to, keep everything straight or remember what they've done or what they haven't done. So as that coworker going up to them and saying hey, I saw you did this today. You have this next. Can I help with that? How is work going? And kind of addressing it that perspective, because sometimes our workload could maybe be too much. And so they just need someone to say, I'll take that off your plate today. And if you do have a personal relationship with that coworker, I think if you see them come into work and you might see them looking a little different or kind of seeming down, saying hey, I see you today. What can I do for you? And just leave it blanket, because I think when you say, I see you,
yes,
that hits and you feel oh, okay.
Yes,
they understand. And it's not saying I see you because you don't look good. It's I see you that something's going on.
Many women might need medical leave, mental health days, or schedule flexibility during treatment. How can workplaces be supportive during this time?
I think that is something we do battle often because we do want our patients to work as they're able to throughout treatment because it does give you some normalcy, right? We're taking away so much of your normal day-to-day routine. And so with work, it gives you some of that normalcy back. And so how, people can kind of support or, managers and that kind of stuff is having open conversations. So if a person comes to you and say, I've been diagnosed with breast cancer, I'm going to have to do chemotherapy, for example. You can say, okay, what does your schedule look like? And so then kind of having an open conversation of, would the best day for you to get treatment be Thursdays because that's a really light day, at the office, so we can have you be out that day. And then saying, hey, we're going to do kind of intermittent leave so you can be off on the days you need to be. So we're not making them be off because if they feel like they can come, great, we want that. But allowing them to say, today is not my day, and I can go ahead and message my manager, talk to my manager, and be off. The flexibility is the biggest thing. We can't be so rigid or so black and white of you have to be here from 9 to 5. Maybe I come at 9, and at 1 o'clock, I am done. Yeah. So can I take an hour break and go home and rest and come back? If it was typically a 30-minute lunch, can we extend that to an hour so I can rest? Kind of trying just to be as flexible as possible, and just showing them some love that this is a lot.
And how can supporters recognize when someone needs space rather than, because I'm always wanting to jump in, I want to fix and help, and is it the subtle cue or should we ask?
So I think everyone wants to help. Everyone wants to fix everything. Cancer can't be fixed in the moment. We're doing the treatment to eventually, quote unquote, fix or to make life longer and everything. But you can't necessarily change it in that moment. And so I think as a supporter, giving them the space of hey, what can we do to show up for you? But if you do need space, can we come up with a code word? Can you tell me, I could be something silly. One of our patients said her code word was banana. And I was like, perfect, great, that works. And so when she would say banana, her family would know, let's step away. Or there's actually, we'd say, get a blanket. And when that blanket comes on, that means you don't feel good. And your family sees that for visual cue of let's give her some time. So kind of using things that you don't always have to say, I don't feel good, or saying no, because that's so hard when you're going through cancer of having to say no all the time. So trying to kind of come up with either a code word or visual cues for them to understand where you're at. The other thing too is, if they say, oh, I'm okay, I'm okay, I'm okay. So instead of asking, are you okay, say, how was today? Because that's an open-ended question. They can say, it was okay, or not my best day. And you're like, okay, do you want something, or you think you just need some time? Giving them the choices and not putting what we want onto them. Yeah. Because that's what I think a lot of supporters, we want to feel good, right? Yes, we want to feel like we've done something. And so instead of putting that on them, letting them tell us and receive whatever they need on our end.
And I love the visual cues, because I imagine with young kids, they can pick up, okay, let mama be. Loved ones often want to advocate for the patient, especially during appointments or treatment decisions. How can someone support and advocate for their loved one without taking away their sense of control?
So some patients, they're so overwhelmed in the beginning. They're getting so much information. And so for a loved one, just to be in the appointment with them, taking notes. Because that way, when you finish that appointment, y'all can go home and you can go over those notes and be like, hey, did you hear this? Did you hear this? And that is still, in a sense, advocating for them so that they're understanding clearer what's going on. I think also kind of having maybe a discussion before the appointment. So, hey, what questions do you want asked today? And make a list, write those questions down. And if you're in the appointment with your loved one and she doesn't ask a question that y'all had kind of agreed on, say, hey, did you want to ask this? Or if she's kind of shaking her head like she doesn't feel comfortable asking it, you can say, I have this question we kind of wanted an answer to. And so kind of going in with a game plan of how that patient wants things to be handled. Some patients are so overwhelmed that they really can't even start to begin to ask questions. So they might turn to you and say, whatever you think I need to know, can you ask that? So again, it's conversations with that person beforehand, and then just also being there for the appointments, because you get so much information that it can be information overload. So sometimes it's just having someone there to listen and like, no, okay, like I'm not crazy. This is making sense. I think that's kind of the best way.
I love that. And then helping track appointments, the process. It's difficult to navigate. Okay, we're going to med-onc and what's next. So you recommend having a game plan going in and then also comparing notes afterwards.
Yes, and like having an agenda. So you have a lot of our ladies, when they get a diagnosis, they get a binder. And that binder has all sorts of information in it. And in the binder, we say add like an agenda to that. So you can write down, if you're in that appointment and they say, oh, we're going to have you do an MRI, you write that MRI down in the moment. But just keeping an agenda, one place that if you're not feeling good, that your loved one can go and be like, oh, they have this appointment this day, because it gets so overwhelming with appointments and who's called me and who am I talking to. And so kind of having that binder and that agenda be the central place where you keep everything, and you know if something is related to this diagnosis, we can go and find it right
central
here.
Place. Beyond practical help, what are some ways supporters can help maintain their loved one's sense of normalcy and bring joy and connection during treatment?
So, I mean, like the simple thing of if the patient's feeling up to it, going to lunch. Did you guys go on coffee dates before treatment? Asking like, hey, you want to go on a coffee date? I'll pick you up. We'll go get coffee, hang out, and then I'll bring you home. So still not treating them like they are unable. I think a lot of people want to kind of coddle or, attend to every single need. And sometimes, yes, that's perfect. But other times, they're doing okay. They're handling it. They're okay. So let them continue to do those normal things. Hey, do you want to go to dinner tonight? We can sit outside. We can hang out, just spend some time together. And you don't have to talk about cancer. I tell patients that from the beginning, as a social worker, we talk about all these things. I'm like, do you want to just have a normal conversation? Like, how's your kids doing? What type of meals do you like to cook? Cancer is not who this patient is. Cancer's a part of their journey, but it's not who they are. And I think as supporters, we have to remember that. It's not who they are. They are still the person you love. They're still that fun, tenacious woman going through life with you. So let them still be that person. Give them the space if they want to do that. Let them go ahead. You don't have to control it for them.
That's so hard.
Yeah.
That's good.
So, letting them do it. We had a patient who really wanted to go to the beach, and she got clearance from everyone, and her family's like, are you sure? And we're like, doctors are saying yes. She's saying she's ready to go. Let her go, because for her, that was what she wanted, and that gave her normalcy. And she came back completely refreshed, renewed, ready to go. And so sometimes giving them that to do, it's like, oh, I got this. Yeah, we're going to get through it.
And then from the patient perspective, you've talked to a lot of patients from the second they're diagnosed all the way through their journey. What does meaningful support look like during the hardest parts of treatment?
Going back to kind of the beginning, it's showing up. When you are in the hardest spot and you feel like you can't do it, and you have someone there who says, hey, today might not be that day, but we're going to try again tomorrow, because there are days that it is really hard, and you don't know when those days are going to come. That's the other thing. No one can prepare you that one day I might be smiling and happy. The next day it's going to hit me like a brick, so you can't prepare for that. And so really being there throughout the whole thing, because when you're there for the happy, fun moments and you're there for the really tough days, but they know you're going to be there through it all, and when you are only there on the hard days, they're like, well, what about my good days, So trying to make sure you're there through the whole process. If it's just sitting with them in silence, sometimes the silence is nice. Or they're crying, you're crying, that's okay. It's not bad necessarily to cry with them. People think we have to be so strong,
right,
and we put on this smile, and it's like, no, it's okay to cry, because it shows them that you're human too. This is hard for you too. And so being vulnerable in that moment and sharing a moment like that brings them so much closer to you, and that is really meaningful. So reminding yourself you don't have to be perfect, because it's, as a support person, you're not always going to know what to say or what to do, but just being there sometimes is plenty enough.
Do you find your counseling more grief, or is it a mixture of anger, grief throughout the journey, bodily changes, or just the newness of you have this label?
I think a lot of it is grief, because I don't think we always recognize that there's grief of the life we had before. So before you had cancer, you were a mom, you were working, you were doing all, you can label yourself as all these things.
Right.
And you get this cancer diagnosis. And there are times that you feel like you are only cancer. This is who I am now. And so it's grieving that loss of that life beforehand that you had, and how do we move forward? So there's times we're kind of stuck in this grief, but then there's also some excitement of what's next. A lot of times ladies will say, this has reminded me to slow down and enjoy these small moments. And so, okay, we went through this whole journey. What did we learn from it? And how are we going to move forward in this next chapter? Because ultimately, obviously, our goal is that you move forward, you forget about us, you don't think about us anymore, and you're living your best life. And so can we almost make it like a learning, like this was a chapter, I'm going to close that chapter and I'm going to go on and, do all the things I said I wanted to do during treatment that I didn't. So there is a lot of grief, and then a lot of transition into, how do I live as a cancer survivor? Right. What does that transition look like? I'm so used to being here every week. So what do I do now with all my free time? So it is kind of preparing them for that next step as well.
And there's a large group of survivors that I get to meet, and it is just so empowering. Yes. For someone listening who wants to support a loved one going through breast or gynecologic cancer, but is afraid of saying or doing the wrong thing, what is the most important thing that you want them to remember?
I think the most important thing to remember is that you don't have to be perfect. You don't have to be everything that you think you have to be. You just have to be you and be there for that person when they ask you to be there. You just need to show up, sit in the hard moments, laugh, when you need to laugh, cry when you need to cry, and just let that person be raw with you. That's all you have to do. You don't have to have the perfect thing to say. No one's going to have the perfect thing to say. So take that pressure off. Just be there. Love them, support them, do what you can do, and let everything else just go to the side, because being there is all you can really ask for.
Thank you, Hannah, for sharing your insight on how we can better support the women in our lives who are facing cancer. Whether it's offering practical help, listening without judgment, or respecting someone's boundaries, even small acts of support can make a meaningful difference. Thank you for joining us today, and we'll see you next time on Unprivate Parts.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.